Many Alzheimer's patients develop agitation, which can be extremely distressing.
One of the most common and most disabling symptoms in Alzheimer's disease is agitation. It's very impactful, very difficult on patients, and particularly difficult for families and care partners to manage.
Dr. George Grossberg is the Henry and Amelia Nasrallah Endowed Professor of Geriatric Psychiatry, and he's the director of the Division of Geriatric Psychiatry at St. Louis University School of Medicine. Grossberg says with Alzheimer's patients, agitation is one of the leading reasons why they end up in nursing homes or facilities for memory care patients.
When the family, the loving, dedicated family, finally just throws the towel in and says, I just can't do this anymore, because their loved one is agitated, maybe even overtly aggressive, maybe even striking out, or maybe is yelling and screaming and cursing all the time, or is pacing incessantly and they can't be redirected. So that's what agitation, the spectrum of agitated behaviors, is all about.
Families may be desperate for the help, and doctors would prescribe off-label medications.
With tranquilizing medications that basically don't have any good evidence that they work, except they sedate or tranquilize the individual. Serious side effects: increased risk of falls, making cognitive impairment worse. In some individuals, they can have Parkinsonian-like side effects: stiffness, tremor, rigidity, and so on.
But things are changing. There's new hope, and Grossberg was instrumental in this. Grossberg and his colleagues helped with the development of the first and only Food and Drug Administration approved treatment for agitation associated with Alzheimer's dementia.
We haven't had anything like that before.
They designed studies for this medication that's originally meant for something different.
Brexpiprazole, which is currently for augmentation in depression. It can be added to an antidepressant to help depressed individuals. And it's also approved for treatment of psychosis and schizophrenia, usually at higher doses. At low doses, it has an anti-agitant calming effect without sedation, without the tranquilization, without the side effects that we were talking about before.
The researchers wanted to see if it would work for agitation in Alzheimer's patients.
I was actually approached by the manufacturer, Otsuka.
The Japanese pharmaceutical company approached Dr. Grossberg and colleagues about the idea of how brexpiprazole, brand name REXULTI, could relieve agitation for Alzheimer's patients.
I was the first author on the publication of the first 2 studies, which helped them to better define the appropriate dose of this medicine. And then I'm the senior author on the study that just got published, based upon which the Food and Drug decided to give this full FDA approval.
The drug proved safe and effective. REXULTI is now FDA approved to treat agitation associated with Alzheimer's dementia. For the majority of patients, it noticeably reduced agitation.
So between 60 and 70, 75% of patients have a good response to the medication. For any drug in this space and in general to be approved, is that the clinician and the family have to notice a clinical improvement. There's sufficient improvement that the family says that their quality of life, as well as the quality of life of their loved one, is significantly better now versus before treatment started. If you follow these people that were on treatment versus those that got the placebo, that there's a much higher rate of ending up in the nursing home without treatment versus with treatment. And then, of course, all of that also translates into benefits for our healthcare economy, because it's expensive to be in nursing homes. And our goal is to keep people at home with their family as long as possible and keep them out of nursing homes.